Dover Foxcroft is a small community. It's just under 5,000 people. It is the county seat for Piscataquis County.
I love living here and being able to work with folks in our community and serving the people in the community. We see each other at the school and the grocery store, and we're able to get a feel for our patients.
There's a relatively low cost of living, great care, not too far from larger metropolitan centers.
It's just really nice to be able to do what I like to do here.
Northern Light Mayo Hospital is a 25-bed critical access hospital. Critical access is a reimbursement status. It means that we agree to keep it only 25 beds. We have a full array, though, of hospital services. So we have a medical surgical unit. We have a special care unit, which is like an ICU. We still deliver about 100 to 120 babies a year. We have obstetrics. We have an oncology unit. We have surgical services where we perform general surgery, orthopedic surgery, urology, GYN. We certainly have our hands in virtually every type of care. The oncology program is fairly unique for a hospital of our size. It's pretty large. We bring a great service to the community by having that here.
The importance of having our center here in Dover Foxcroft is it does provide the patients more comfort from not having to travel.
And if they had to go all the way to Bangor, I mean, they would be leaving their homes at 4 or 5 o'clock in the morning and not getting home until 8 or 9 o'clock at night.
But they're able to be treated by their own people in their own community. So that makes a difference. It's a much more family feeling.
You can't only be focused on your mission of caring for people that present to the hospital for care. You have to really be doing the preventive care and looking at other types of community needs like food insecurity.
In our area, Piscataquis County, in our area is one of the most rural areas and the highest rate of poverty. And people are very proud, so they don't want to admit that there's food insecurity.
So the Christine B. Foundation is a grant that allows us to help patients with cancer have food to make sure that they're eating and staying healthy so that they can continue to get their treatments. We're asking all patients, it doesn't matter how much money you make or if you need it or if you don't, it's if you would like it, this is available for you. And it's been very popular. Everybody's really liking having that. Patients just really appreciate everything that we do, trying to just make patients feel like we, are looking at the whole patient, not just the cancer, because there's more to them than just their cancer, and treating the whole person.
In most rural communities, the hospital is the center of healthcare for the region. We are public health. We are primary care. We are the ambulance service. Everything sort of leads back to the hospital in a rural community.
This hospital really came from the community. In 1935, Colonel Edward Mayo, who was one of the owners of the Mayo Woolen Mill down in the river here in Dover Foxcroft in a big man around town, died and left his house, his mansion here on West Main Street, to the town for the specific purpose of being the town's hospital. In 1936, it opened as Mayo Memorial Hospital. That building existed as a hospital until the mid-1970s when the state came through and said, this is a nice building, but it doesn't meet current building codes for hospitals. Hardwood floors are nice, but not in an operating room. You really need to have a more modern facility.
There were hospitals in Milo and Dexter, as well as the one here in Dover Foxcroft, and they were consolidated into what became Mayo Regional Hospital.
This building opened in 1978. This has been serving the community as Mayo Regional Hospital since then. In March of 2020, we became the 10th hospital in the Northern Light system.
That was after about 5 years of work. The timing of the merger, given the events of the pandemic, could not have been better.
I cannot imagine what we would have done if we had been an independent hospital trying to mount the response that we have mounted to help with educating our community about the virus. We would have been lost without the system's ability to mount a system-wide response for all 10 hospitals.
I think our vision for the future is to continue to be a strong collaborative partner within the Northern Light Health System. And so our focus now is really about being the healthcare system for Piscataquis County and working as closely as we can with our partners at CAD.
What's important to us is having a hospital here in the community to take care of the community. So I'm proud of the fact that we were able to work through the anxieties that the communities had, the concerns that the communities had, that we answered their questions and we got their support. And at the end of the day, 98% of them said, we want this hospital to become part of Northern Light so that it will continue to be here for us, for our children, for our grandchildren.
I've been just astounded at what people have done to care for the community, and they've just turn and pivot every day.